If you look at those numbers in Gauteng, it's no real surprise that there are many people saying we're running out of hospital beds. And we don't just mean public hospitals, we're also talking about private hospitals now, as these infections are surging higher than in the first and second wave. Health workers also once again in the firing line. Let's talk about those two issues. It's a huge pleasure to welcome Dr. Donny Fick from Netcare Milpark Hospital to find out what it's like for them during this period. Dr. Fick, good morning to you, and it's a pleasure to have you with us, and thank you to all of you and your staff for the incredible work you're doing. We'll talk beds in a moment. First, just tell me, how is Netcare Milpark Hospital doing? How are the staff doing in this third wave?
Tired. One word, tired, exhausted, but digging deep and trying to find ways to help people. I think this pandemic's been going on since March last year, and many healthcare workers haven't had a break since then. So I think it's just making things slightly more challenging on the ground as well, that staff aren't motivated, staff are demoralized, and it's difficult. It's really difficult.
What if you had the power to do anything you could, Dr. Fick, to try and help them, whether it's morale or more sleep, all of the issues, and I'm sure there's even more issues than you just mentioned, what would you do? What could you do? What would you like to do?
Oh, that's a difficult question. Send them all on holiday and give them loads of caffeine, but I don't think that's realistic. I think something needs to be done higher up, and I think there's a lot of people, healthcare workers aren't very, dare say, impressed with government at the moment. They felt stronger restrictions had to come in earlier. Like now that things are really bad, now there's sort of a reaction, whereas we knew this was going to be the case 3-4 weeks ago. We could see things climbing, and now that things are out of control, now sort of they want to step in. So there's a lot of faith that's lost in the higher powers, unfortunately.
Why do you think government isn't listening to the experts? That's one of the criticisms. They're not medical doctors, they're politicians. Why isn't government listening, do you think?
And I think you've hit the nail on the head there, Gareth. I think it's got a lot to do with politics. I mean, as I said, we've seen the start of the third wave weeks ago. I don't know how this balances. I'm not in business. I work in healthcare. We know that the system's stretched. Obviously, personally, I'd love a level 5 circuit break restriction now, just to take the pressure off. But I don't know what implication that has for business, for economies, those kind of things. And I think I'm hoping they're taking all of that into consideration when making that decision, that it's a fine balance, as they always say.
Do you think we could end up with, I'm calling it a provincial lockdown. I'm sure there's a fancier way of saying it, but a provincial lockdown for just Gauteng? I mean, the numbers that Michael Murillo and I were looking at, Dr. Fick, just in this province, they're staggering. It's almost hard to believe that the numbers are so high. Do you think, would you support a level 5 lockdown in Gauteng? Business aside, let's talk health. You're a doctor, let's talk health. Would you call for a level 5 lockdown in the province?
Yes, definitely, without doubt. It is so difficult to access a private hospital bed in the city at the moment. I mean, I work in an area where you've got Milpark, Garden City, Donald Gordon, Rosebank, Sunny Hill, lots of big clinics, all in a very concentrated area. You can't get a patient admitted. It is so hard. You have to make so many phone calls and hope and pray that they will take a patient who's got oxygen saturation of 80%. To put it into perspective, on Sunday I had a patient who had desaturated on day 4 of a COVID-19 infection. He had sat of 80, had to wait for 2.5 hours to get to the emergency room in an ambulance.
Can someone die in that time?
Yes.
So what happened to that patient?
Gary, also got a knock-on effect for every other medical condition, COVID aside, if you have something else. And there's a whole range of medical conditions that you could have that require hospitalization and ICU bed. That's hard to get at the moment as well. So not only for COVID patients, but sick patients in general, this is a very difficult time.
Beds-wise, talk to me about inside the building. Is there just literally no space? We can't make space in the day wards, or we can't move some office furniture out the way, get another 20, 30 beds in somewhere? Just tell me about the hospital. I haven't been in a hospital in more than a year now.
At the GP clinic that I work at as well, so they've erected tents in the parking lot. It's all good and well to create space, but we need hands. Like, you need people to man those beds. And there's a huge shortage there. There is just very little staff at the moment. So even though they can move office furniture around, open up like cleaning rooms to make them like beds, You just need hands, and we don't have hands. We can increase capacity, but you need people to look after those patients.
Dr. Fick, final question to you briefly, if you could. I had an interview the other day with this hashtag movement, Unemployed Doctors in SA. It's some 286 doctors, I think was the number. It might be more. Forgive me if I got the number wrong. How much of a difference would that make if you had those doctors as unemployed doctors, whether they're interns becoming doctors or they are doctors? It's a bit of a grey area. How much of a difference would that make in your life?
It would make a huge difference, Gareth. I mean, just interns have the capability of putting up drips, drawing blood, basic care, which is needed. I mean, you can't have ICU specialists running around doing all of that, plus making like big clinical decisions about patients. You need support staff. You need people to do those bloods, put up those lines, intubate those patients. And those 286 people's hands would be more than valuable right now. So I don't know why. Get them into the field.
It's exactly what I said the other day, and it sounded like a bureaucratic issue. 2 intakes a year, 1st July, 1st January. It's absolute nonsense. You need them now. Got to speed this up. Dr. Donny Fick, thank you. I appreciate your time in speaking to us this morning. I'm sure we'll speak again. That's really what's happening in hospitals, South Africa. That really is what's going on. That's Dr. Donny Fick from Netcare, Milpark Hospital. Coming